Well, the British Medical Association is balloting junior doctors now over a future strike. Its chair, Dr. Philip Banfield, is with us now. Thanks so much for being with us.
Good morning, Sophie.
First of all, can you just give us a bit of an honest appraisal about what it's actually like to work at the NHS right now?
Well, our members have never seen so much stress, so much moral injury from not being able to undertake the care that they're so desperate to give. This has arisen because we just don't have enough beds for the health service need at this point in time. Now, part of that is not being able to discharge people from hospital, and that creates a kind of log jam. But this is years and years of running down the number of beds. So we've got half the number of beds available to the health service that we did 30 years ago.
You talk about years and years. I think that is quite important, isn't it? Because the government often talks a lot about COVID and says that this is part of the knock-on effect of the pandemic. Is that right?
What the pandemic has done is aggravate a situation that was deteriorating, and we have been highlighting really for 10 years or more. So, if you look at the figures, the waiting list had gone from 2.6 to 4.4 million before the pandemic. It's gone over 7 million now. This is an absolute national scandal.
And we spoke on the programme last week to the chair of the sort of acute emergency medicine, and he was talking about the fact that this basically means people dying. If an ambulance can't get to them in time, if they're waiting for A&E, is that the brutal reality of it?
That's a really good word. It is brutal on the front line at the moment. We see our GP colleagues buckling under the weight not only of people who are worried about things that are going on now, but they're bearing the brunt of the backlog because people keep going to their GP.
And what does that mean? Does that mean hundreds of people trying to call at 8 a.m. to try and get an appointment and failing to?
Well, it does. I mean, it means that they're filling the face-to-face slots and having 30, 40, 50 online consultations as well to try and fit in. But what it translates to is patients making conscious decisions with their GPs not to go to hospital when they need to, because they don't want to languish on a hospital trolley. And my wife, who is a GP, had 12 hours on an A&E trolley with chest pain, thinking that she was going to die on her own because I wasn't around at the time. And this is the kind of trauma that is being suffered by patients, and the staff could not be trying harder. There's no fault on the staff. How on earth emergency department staff keep going? And we do know that it's affecting their mental health, and we do know that it's causing burnout. I'm
really sorry to hear about your wife. That's an incredibly sort of stressful situation for her and also for you.
She's better now.
That's good.
And in work, so
I'm glad, but It does, I guess, highlight what so many people are experiencing. We've seen nurses and ambulance workers going on strike. A doctor's strike's inevitable.
They're not inevitable at all. We're balloting at the moment, and the result will come in 5 weeks' time. And now is the time for us to get down with government and vice versa to find a resolution to this. Now, we met with the Secretary of State for the first time, but actually, now that we've done that, it was not as negative as I was expecting. There are things that the Secretary of State can do business with us over, and that would include trying to give back confidence in the pay review bodies, for example. But there are things, as he points out, that it's the Prime Minister and Chancellor who are controlling. And he made the same offer to us as he's made to the other unions, which is try and help him with the economic argument. And the economic argument is strong. We're spending a lot of money on locums with the fact that the health and wealth of the population is deteriorating, and that gap between the poor and the rich is widening, and that translates into an economic crisis as well. And it doesn't make sense to make people sicker, and we know that the country is getting sicker as a whole. Let's get people back into work, then they can pay their taxes. So, for me, it's a very straightforward market economics argument. Doctors are leaving the NHS. They've got choice. These are bright young graduates. Their entry pay just over £14 an hour. Full pay restoration for them means £18 an hour. We have to decide as a country what the value for the expertise for junior doctors is. And junior doctors are not junior by any means. These are skilled, highly trained professionals.
I'm interested, quite heartened, I guess, to say that you think that it perhaps wasn't quite as negative as you would expect when you met with the Health Secretary, Steve Barclay. Do you think that he's willing to move on pay if you give back a bit on reform then? Is that effectively what happened?
Well, I've met him for just over an hour, right? That's the first time that I've met. So, it is all for what happens next.
What happens next?
And the indications are that we will be having that dialogue. While we're having dialogue, there's always the possibility of averting industrial action. No doctor wants to go on strike. No nurse wants to go on strike. We feel that we're being backed into it.
I'm interested to get your thoughts on Labour's position as well. Keir Starmer, in an interview today with the Sunday Telegraph, said the NHS must reform or die, and the idea that the service is still the envy of the world is wrong. Is he right?
Well, when the NHS works, it is superb.
But is it working
right?
now?
You cannot beat it. And there are times when it works. It's not working for everyone. Right? So there are some really, really brilliant bits of the NHS that happen day in and day out. And we are emphasising that the NHS is the future for this country because it should be the most effective and efficient health service you can have. Because if you don't take profit out of it, that money should be available.
But, Labour says that they would like to, for example, bypass GPs, allow people to have safe self-refer. Is that a good idea?
I met with Wes Streeting this week and we had to agree to disagree that he doesn't understand general practice. And the GPs are one of the most efficient and effective parts of the health service in the way that they manage risk. They are superb at it.
So you don't think that Labour really understands how the GP system works?
Well, I think that they have a lot of work to do between now and an election. We have offered to help them with that. We'll do business with anyone who has the right policies. This is not about party politics for us as a BMA.
So why is self-referral a bad idea? Because some people think, look, it's obvious, I can't get through to my GP, I can just self-refer, way more efficient.
It's not efficient from the point of view that what tends to happen is you have people who are the worried well, and the people who really have an issue say, I don't want to bother my doctor, right? I don't want to have take up someone else's time. So you then end up, paradoxically, with a widening health inequality.
Because some people will just refer themselves straight to specialists when actually they don't need to be.
Correct.
OK, understood. I guess what Wes Streeting would say is that you may be part of the problem. He's described the BMA as hostile to his plans. He says he's not afraid to take on the doctors. Keir Starmer as well, telling me last weekend, we've got to have battles. My experience of reform is there will always be people who say, I wouldn't do that. I disregard that. We're not going to back down the first time someone says, I wouldn't back down or I wouldn't do this. They're willing to go into battle with you.
Doctors are not the problem. They are the solution. You need us as experts to deal with the problems of the NHS. We are not averse to change. It's a complete fallacy that doctors want a health service to stay as it is. We're the first people to say we want change in the health service, but please can we have it evidence-based? Please can you listen to frontline staff? And please can you invest properly in a health service we can be proud of?
Really interesting to talk. Thanks so much for being on the programme today.
Thank you, Sophie.
Thank you.